Is the backbone of Kerala's medical industry crumbling? Kerala's nurses allege they are underpaid and were on strike a few weeks ago protesting for their dues. After 15 nurses were suspended for going on strike, Kerala's nurses are protesting again. Sneha Koshi reports.
Nurses being dragged away by the police. After 1,000 nurses on strike blocked the entrance to the mother hospital in Thrissur. Just a few weeks ago, thousands of nurses were on strike for 80 days in Kannur. With 15 nurses being suspended on disciplinary grounds, nurses across Kerala stand united yet again.
We are on strike for our needs, the basic needs of the nurses, that is nurse-patient ratio, then the harassment, against the harassment, and also salary.
It is said that for every female there should be a sexual harassment cell, but no hospital has such a cell. Most of the hospitals are asking us not to get married. Even if you are getting married, they are asking us not to become pregnant. How is it possible?
The Balraman committee has recommended optimum salaries for nurses. It recommends a revised basic salary of 12,900 rupees for a staff nurse. But there are nurses who don't even get the minimum salary in Kerala. The frequent strikes have also taken a toll on the doctors and patients. Patients are being returned from the hospitals without being admitted for the lack of nurses available on duty. Some say there have been instances where nurses have taken undue advantage of the situation.
I think the nurses should not go on strike. Point one. Point two, I think the government should intervene and correct the faults that the administration is perpetrating on this profession.
Here for the last 1 week, we are not able to admit patients. Many of the patients who are very sick being brought in the casualty, we are just giving the first aid and referring them to some other outside peripheral hospitals.
Where the state government is being criticized for its indecisiveness, there are fears that these unresolved agitations might make way for the entry of big corporates into Kerala's healthcare system, making it much costlier.
The Kerala model of healthcare has been appreciated all across the world. The key to that lies in being able to provide the best of medical treatment even to those with a low per capita income. But will Kerala be able to sustain this? With the backbone of the healthcare industry, that is the nurses, struggling and fighting for their rights for a very long time. Perhaps now is the time, at least, that the government takes a decision. With camera person SP Babu, Sneha Koshi for NDTV.
India's #1 news app just got even better. Download NDTV's new app. Fully optimized for retina display. Full screen view. Faster response time. And Sudoku. NDTV's new iPad app. Download now.